And what I want you to pay attention on the next slide are the laboratory parameters that are indicative of the disease that you probably are very familiar with. So there will be a falling hemoglobin or a hematocrit, depending on how your doctor does these things, which, if it's hemolysis, will be associated with a rising LDH, a rising bilirubin, and a falling haptoglobin. And we don't have to do all of these tests all of the time. Just one or two of these in the right setting will be enough for us to track a disease. Falling platelet count and rising creatinine. So those are the three sort of cardinal features of aHUS, hemolysis, low platelet count or thrombocytopenia, and a rising creatinine. And when those things happen, the disease is progressing. When those things reverse, the disease is being stopped in its tracks. So here, if you will, is what that looks like. And I wish I had a pointer. Maybe I can use this. There we go. So it's a little bit of a busy slide, but on this axis is the platelet count. And so you want to be higher on this axis. On this axis is the creatinine, and you want to be lower on that axis. And at the bottom of that same axis is haptoglobin, and you want to be higher on that axis. So here is this patient now looking at the story 6 days before eculizumab or Soliris, who has had a kidney transplant, whose in black is the creatinine, whose creatinine from 1.2 is starting to go up. The diagnosis is made very early on, despite a very modest rise in creatinine, because in red is the platelet count that begins to fall from about 115,000 or so down to 75,000. So physicians very promptly made the diagnosis. They had a very high index of suspicion because this was their second transplant for that disease. And you can see that at that time they also measured the haptoglobin, which was very low. So hemolysis, low platelets, kidney failure, classic atypical aHUS recurrence. Patient starts plasmapheresis, has 4 sessions, platelet counts continuing to fall, no change in haptoglobin, creatinines continuing to rise. And that's when eculizumab is used. A single dose of that drug is given, and you can see that very dramatic fall in creatinine and just as dramatic rise in platelet count and a gradual rise in haptoglobin back to the normal range. So it's an incredibly dramatic reversal of a disease that up until that point really had no other effective therapy except plasma, and you can see that plasma therapy is not always effective.